So I'm gonna ask all the members of REMAC to come up to the table because you guys are members of the committee. So please, you're welcome to join the committee at the table. And then thank you for letting us start a little bit late. The Airway Committee ran a little bit late. It's 2:22. I'd like to start the December meeting of Nassau REMAC. Start with the Pledge of Allegiance. And then a moment of silence, please. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. We have a quorum. We have 9 voting members present. We need 5. 2. Just as a reminder, this is a public meeting. All our public meetings have to be held in person. Webcasting is for viewing only and doesn't count towards attendance or quorum. I received excuses tonight from Dr. Kirshen, Dr. Mulbauer, Dr. Shearson, Dr. Ryan, Chief Chester, and Dana Cordopasso. I need a motion to approve the minutes and attendance that were sent out. Second. A second, Dr. J. Cooper. Anybody opposed? Against? Okay. All right. So regarding correspondence, let me just get my notes open. New York State sent out just today 3 letters, plus there were a couple of agencies and folks listed online. The first one is Corona Community Ambulance Corps, Agency 7344, for violation of Article 30121F. Their agency certificate was revoked effective December 2nd. Ramapo Valley Ambulance, Agency 4319, for violation of 30121F, 1D, 1B, and New York Code of Regulations 800.21J and 21A. Their certificate was revoked October 17th. EMT Wayne Allen, 377943, for violation of Part 800.16A10, summarily suspended pending a hearing on November 14th. Christopher Pelock, EMT 167410, for violation of Part 800.16A1, suspended for 1 year effective 11/22/24. Suspension is stayed pending successful completion of a year of probation. John Keever, EMT 220841, for Part 800.15A2, 800.15B1, revoked effective 12/9/24, assessed a civil penalty of $2,000. And this last one is quite impressive. Kadisha Garcia, 482007, for violation of 800.16A, 1, 2, 3, 9, and 11. Suspended for 1 year effective 11/26/24. The suspension was stayed pending successful completion of 3 years probation. Assessed a civil penalty of $12,000. Of that, $8,000 shall be stayed pending no further violations during the period of probation. Huge for an EMT, not even an agency. That was all the incoming. Outgoing, there was email sent to SEMSCO, CMAC, and Bureau of EMS leadership requesting closure of ongoing cases. That was followed up at the last meeting. And a thank you to Dr. Winslow for his attendance at our last meeting. With regards to reports, I'm just going to keep moving. Are there any questions on any of that communications? Okay. For my report, we're in a season of giving thanks and appreciation. I just want to make sure that everybody here understands that I appreciate everything that you do, and I'm thankful. I would like to thank you all for your continued work in helping steer EMS in Nassau region. these past few years and helping us steer it into the next. The work we're doing is slow, but moving. There's occasional bumps in the road, but we're making forward progress. So I'd like to wish you and your families a safe, happy, healthy, and joyous holiday season and new year. Secondly, I'd like to recognize, I did this as my report out to the REMSCO, but here at this committee, I'd like to recognize the REMSCO chair, Chuck Mackey. Chuck, you've dedicated an enormous amount of your time as both in multiple officer positions in the REMSCO. Always been an advocate for this committee and for the citizens of the region. For your years of leadership, collaboration, and your vision, seeing outside the box and creating things that didn't exist and enhancing things that did. Your support was outstanding during your tenure as vice chair and chair of REMSCO, continuously serving to push and lead the way to improve everything that we do, both locally, regionally, and statewide. You've touched all the facets that I could think of that we touch upon here in EMS and at the REMAC, including quality, communication, infrastructure, helping to rebuild our program agency from one that was non-functioning to one that is highly functioning and being continuously rewarded its state grants. I don't think we will be where we are as an RSI region, as a just as having the collaboration that we have without your leadership. So thank you very much, and I wish you good luck as you in your ex-chief chair position.
Thank you very much.
I could give you a plaque or something. We put the REMSCO, the REMAC doesn't have a budget.
You need to hug.
No, we don't have it. We don't have it. They would. So, I just also want to follow up. At the last REMAC, we voted to bring up an item to the New York State Bureau of EMS and to the New York State Attorney General. There was a New York State CMAC meeting after that meeting, and there was one just recently held. The Bureau leadership, which is Ryan Greenberg and Steve DeZura, and the CMAC leadership had thought it best that we work locally and with those leaders to sort of help address the questions that we posed to them. So with that, we've had multiple phone calls and multiple meetings. We have a meeting tonight with the executive committee, which is the chairman of each subcommittee of the REMAC and the REMSCO tonight at the FPA at 7 o'clock with Ryan Greenberg, I think Steve DeZura, and the Division of Legal Affairs. So if you're on the executive committee of either the REMAC or the REMSCO, you should have received an email to be at that meeting. So I think that will help answer some questions, because the Division of Legal Affairs is going to be there. What Ryan told me was, even though the attorney is going to be there, they may not be able to answer the questions, but they're going to be listening. And then they'll get back to us with an answer, which is all we want, right? We want somebody to help guide us. And this way, it doesn't have to be a bigger deal than it should be. Any questions on that chairman report? You guys, as the officers, have any report on? Not, we'll get to communications and quality in just a minute. All right, so with regards to CMAC, we just had a meeting last week. There was a discussion about the collaborative protocol change log, and there were a couple of changes that were made, including changes to cardiac arrest in the 2025 protocols. So they tried to make them consistent with the AHA guidelines. So those changes were put in place. There were changes for lidocaine and its appropriate indications, vector changes for refractory VFib and dual sequential defibrillation, changes to collect points of clarity for allergy or anaphylaxis. Olanzapine was added, IM or sublingual. And if a patient becomes agitated, for the, within protocol to give, sodium bicarb. The order of medications to be given was changed in cardiac arrest, again, to be compliant with AHA. Pulmonary edema was addressed, so IV bolus dosing for IV nitroglycerin was emphasized, not the infusion. For hypoglycemia, believe it or not, maple syrup was added as a protocol option instead of the instant glucose.
The real stuff, or the other stuff?
New York?
So, yeah,
Canadian?
it had, so it was a discussion, it was for the upstaters, I was,
Vermont protocol.
right.
Can we get it slurped at 7-Eleven?
Hey, if they could add,
The downstate.
yeah, for Long Island, we should allow 7-Eleven Slurpee.
Yeah.
For heat emergencies, they also added placing ice packs on the palms and soles. Moxifloxacin was added at all levels, by mouth, for adults only, and peds dosing was added, for ALS. Cefazolin IV for the medic. Trauma-associated shock initiation of pre-hospital blood products under emergency regulations. TXA indications, that they added obstetrical emergencies. Formulary, they added one antiarrhythmic. The agency can carry, a second one if they so choose and they're trained. EMT supraglottic airway placement is regionally approved if equipped and trained. They removed the viral filter requirement. And that if, they emphasize that if a supraglottic or any advanced airway is used, waveform capnography is required. And for the AEMT or higher, PEEP may be used if equipped and trained. There was a discussion about a glucagon pilot project started in Suffolk County that was voted and passed. Where now that they have the BLS epinephrine check and inject, the ability or the scope of practice for an EMT to draw up a medication into a syringe, measure it out, and inject it intramuscularly is an approved skill. So then they extrapolated that out. Now they're doing a pilot project that's being led out of Suffolk County, and it's going to be statewide once it's approved by the Commissioner of Health for BLS glucagon. There was a discussion about intranasal versus intramuscular. But intramuscular is 1 milligram, intranasal would have to be 2 milligrams. And given the costs, it's most likely not going to come to fruition. There was discussion by the Innovations and Research Committee, Doctors Redlener and Dr. Maloney, that Wadsworth is expanding the scope of lab testing available to the community paramedic. They're willing to do some of these tests under wavering like the blood glucose, so you don't need a special lab license. But that's something that's being looked at. Something that they mentioned that was important is that blood glucose testing for BLS first response organizations. Those organizations are not exempt from the $200 fee unless they fall into that exemption category, which is they have to be an EMS agency, which BLS first response organizations don't transport, so that excludes them. So I think there was somebody may have asked the state why they couldn't, why they have to pay the $200. Oh, here, this is the explanation was the law requires the fee be assessed for any agency that is not one of two things. They must be a voluntary ambulance and that you are operating under contract with a municipality or other municipal government. And the other test was if you're a volunteer agency under PHL, Public Health Laws 579.3, and Public Health Law Section 3001.3, which defines under a city, town, or village. And they talked about General Municipal Law 207B, 209B. So if you have questions, contact Steve Deser if you want to know why you do or do not have to pay that $200 fee. The workforce committee at the state level produced a report, a 2024 updated report on where the providers are. That was, I think, sent out by Don to everybody on this committee. It's reflecting that there's really a sad state of affairs where we're at in terms of pre-hospital care. The numbers of volunteers is going down, the number of providers that are active is going down. So if you're a leader in an agency, be kind to your providers and be thankful to them. And knowing what they're doing is it providing an essential service, and that we need them more than they need us. Okay, the numbers are clearly evident. We know that there's no funding, or the funding is pretty crappy. And a lot of these guys could leave for better paying jobs. So we need to recognize the providers for what they do, for how they do it, and thank them at every turn. New York State is doing spot inspections. They've completed their cycle of 2-year inspections. They're restarting. So be mindful of that. Make sure that your agency's up to snuff with the regulations. They upregulated or opened up their patient surge center in upstate New York. Down here, we have an abundance of bed space apparently. But upstate New York, they've had hospitals closed, and so they have a patient surge center that they opened. They've stated that blood is now able to be carried for air medical and for ground, but you have to watch for the regulations coming out in 2025. Previously, the application process for an EMS agency to become a transfusion service was through Wadsworth Labs. The State Department of Health shifted that over to the Bureau of EMS. So it should make it a little bit more seamless. Brian, when he gave his bureau report, he also said that for agency medical directors, he emphasized that if your agency is closing, the New York State Bureau of EMS and Department of Health have policy statement 13-09, which require / mandate that if your agency is closing, you must notify the State Department of Health. That's the physician has to do it as well as the agency director. He talked about the program agency funding. They hired a whole bunch of new people up at the state. If you have a military, if your EMT card or medic card is expiring, but you're in the active duty military, they're extending your expiration date. So they've been working on that. He's mentioned Nemesis 3.5, so they moved to the new data set federally, and he said that there are fewer hangups, which means most of the PCRs are being exported. New York State is moving to this quality assessment tool called NEMSQA, NEMSQA. And they have core measures that are online. You could Google it. There's some for airways, some for stroke, some for emergency response lights and sirens use. The state is looking at those and they're reporting it out statewide based on the PCRs that are getting uploaded. I'd say take a look at it, make sure your agency sort of is falling in line too, because you don't want the state to come and say, you know, why is everybody not using lights and sirens, but you guys are, or vice versa. Vital Signs is going to be in Syracuse next year in 2025. If you're interested, I know it's a year off, but I figured I'd report it out. They said that during one of the large mass gatherings up in the state, they opened up one of the CDC chem packs just to familiarize themselves with it. And they didn't discuss the contents of it, but for those that know, and for those that need to know, find somebody and ask, because you should be familiar with what's in it and what's available and how many people can be treated. He said that with regards to regulations, the quote build out specs for the vehicle is coming out in 2025. And that equipment discussion is closed for public comment. It's now going into, into publication for secondary public comment in January. And community paramedicine is in the vetting process of being approved by the commissioner. One last thing was EMS wait times. There's a website or there's a data link that I think Don may have also sent out. For any EMS provider, if you're stuck at a hospital and you want to report that to the state, you could do so by just clicking a hyperlink, putting in your name, your EMT number, your agency, and the hospital that you're waiting for, and any comments about why you're waiting. And the state tabulates that data. So for the hospital folks here, just know that EMS providers are empowered to report excessive delays. Now, that doesn't mean, 10 ambulances arrived all at once and, you're the 10th ambulance and you have to wait. It's like nobody's in front of you, nobody's behind you, and you're still against the wall waiting to be triaged for half an hour. I would make a complaint locally and then, ring the bell at the state, let them know that this is an issue. Because they need to track it and they need to find out if it's just a problem upstate or if it's a problem downstate or both. In the weekly EMS coordinator report is a average wall time report that's put out based on the hospitals. I would say when we look at our wall time, and that's just a generalization because it's EMS arrival to EMS back in service based on your PCR data. Our wall time is still better than most regions in the state. There's 18 regions in the state. We have one of the best. So again, on the hospital side, kudos to you. As a provider, I understand we're volunteers and you don't want to sit against the wall for 30 minutes. But just know that there's some places that the volunteers are waiting, or the EMS agencies that have 2 or 3 hour transport times to the hospital, they're waiting for hours to offload their patients. So I think we're doing pretty good down here. Are there any questions about the statement, EMS report? Okay, great. QAQI, Dr. Zazzo.
Good afternoon, everybody. No meeting this month. This cycle. We'll have one in February. There are issues that are still in the works. And as we discussed with the meeting with EMS tonight. So we'll report back once that's done.
Great, thank you. And then moving on to Airway RSI.
Hey, everybody. So we had our meeting prior to this meeting. Just a couple things that came up. We just talked about the importance of confidentiality, and I think that we have a very good, our area committee has been really awesome with pushing a lot of things forward and a lot of really, really good discussions. And we just discussed ways to ensure that our discussions stayed, within the committee, that were spirited, so that way we would feel comfortable, but that we would still make sure that we were allowing agencies to work at their own level. So we're working on that a little bit, but obviously want to make sure that everyone knows what we do and that we report out to the region all the good stuff that's been coming out of our committee, and we're very proud of that. And I just, before I go forward, just would like to thank everyone that's been participating with that. It's been what now, a 3-year process, I think, and it's been very, very productive, and it's been a lot of people involved, so kind of like a grassroots effort, and it's really been good. Northwell would like to be an RSI agency. We are putting that forward to a vote with 2 asterisks. One was the data collection. The way that Northwell collected data may not quite match up with us, so we have to figure that piece out. And the regional training piece, because everyone, our standard is that everyone takes a difficult airway course and then takes a regional training course, so that way we have regional oversight of that. And so we just have to figure out those 2 pieces. So would like to put it forward to a vote that North will be an RSI agency with those 2 things that we were going to work out at our next meeting. They're going to come back and talk about that. So we'll bring that up if that's a seconded motion for the group. Rescue medic training, we agreed as a committee level that the New York City rescue medics, that their training that they get to become rescue medics is the equivalent of a difficult airway course. That does not preclude them from having to take the regional course. We still have to do the regional training with them, and they still have to meet all the other requirements, and they still have to have their medical director vouch for them. So the that came up because of we were able to get through the grapevine that the level of training that they get, is equivalent, or we agree is equivalent to, the training. Suffolk County has been doing reciprocity with us. We actually had a class where were we, Dix Hills? Deer Park. Oh, Green Lawn. So we did a class, in November, and it was a couple Suffolk County people, but actually it was more Nassau County people. So we have been working very, very well with our Suffolk County colleagues. That's that regional credentialing course. We're also working on developing our own course through our friends at the FPA, and there will be an option for that. We just haven't, we really haven't had a lot of, requests for that, but if we start getting more agencies and more people, we will do that. Otherwise, we will partner with Suffolk because that also has worked really well. And both myself and Dr. Silver and Scott and a couple of our other Nassau County folks were there helping teach in the Suffolk County. So we're actually sharing our educational experiences. So that has been working out very nicely. So the fact and anyone, if we have our own course, it takes a course here, Suffolk County will recognize it. So that's nice. IGEL, for Seacliff, we approved them provincially because we had missed the last meeting, so I just need a motion, at this meeting at our motions to just approve them as an agency, and Dr. Silver will be taking care of their training.
Already done.
Already done, okay, great, so we just need them approved as an agency, and that just, they sent their application in right after our last REMAC meeting, and we didn't want to hold up their training, but we just need them approved so they can move forward. And just the other thing that I just want to, and this is super important, we've been really setting high standards for ourselves here in Nassau, including that every agency that wants to be an ARS agency, their medical director must come and present the agency to us and answer questions, which we were doing today with Dr. Berkowitz from Northwell. And every RSI provider that we're presenting, the medical director has to be there to present their RSI medics for approval. And so I think that is, Suffolk County has a group, and they're very, very active and they're very good, but they have their own committee, and it's not necessarily the individual medical directors. And I think the fact that we have the individual medical directors do it has been really beneficial to us. And we've gotten compliments on that from our colleagues in Suffolk about how we're doing that. So I think we learned from them and we built on that. And I think we set up a really good system, and that we're setting standards. And you know, that's really good spirited discussions where we're trying to figure out where our standards are and how we're moving that forward. But I think that we're in a good place right now, that we're having good open communications, and that we're moving this forward in a safe way, that we're engaging people and we're making sure to monitor. We didn't get a chance to look at it, but there was an MFI recently in Glen Cove. So just so you know, the Airway Committee is reviewing all that. Our committee, we are reviewing all of those, you know, airway. There was a question about another airway that we can pull that data. So we are doing the QA as well. So that's working out really well. And there were 6 additional medics that were approved for RSI, 3 from New Hyde Park, 1 from Lido Point Lookout, and 2 from Glen Cove. So that's that our meeting. So now we have so that's the slate. And thank you, everyone. And again, I just appreciate everything, the input of everyone that's been helping out regionally and with our committee. I think it's been really a success story, and I appreciate everyone. And for Dave stepping up as the vice chair, thank you. And just looking forward to more good stuff in 2025.
Great.
Basically nothing. Sorry. Protocol, Dr. Ryan.
Slurpees.
Yeah, Slurpees.
Maple syrup.
Dr. Ryan is excused from the meeting, no report. Under credentials, there's been no meeting and no new business. Policy Subcommittee.
So there's 2 policies that are already been coming up. One is OLC. So once we have some direction from the tag that was created on what they want that structure to be, we'll be able to create language around it. The second is on diversion, which I know is unfinished business discussion, which I believe the conclusion of the last meeting was the ED hospital committee was going to discuss it at their next meeting. They get a consensus of what Nassau wants. And once the ED hospital committee comes up with a consensus, because I don't think everybody wants just my opinion on it, we'll edit the diversion policy to fit the county's needs.
Great. Thank you. Any questions? Okay, RTAC. Has there been any?
So I did attend virtually. RTAC had a meeting last week or so. They will be putting forth a rep for REMSCO, which will then follow the normal course of the membership committee meeting and yada, yada, yada. But they are meeting, and again, what's on their radar. TXA is on their radar. They're very mindful and interactive with EMS, so we thank them for their partnership and look forward to moving forward.
Are they thinking of adding TXA? Because, initially they said no. Because that would require the region to.
Yeah, I would defer to the docs. The short answer is no, not right now. There seems to be no compelling need and short transport time and all those discussions, but it is on their radar and, obviously. I would suggest, whether anyone feeds back to the REMAC or to RTAC directly, if you feel differently or, want to have that conversation, those are the two places to have it, so.
Can I ask a question? Mount Sinai South Nassau's trauma team was asking how to get onto the REMAC or to get it because they're not getting the notifications.
RTAC?
Yeah,
I'll get to
yeah,
that line.
awesome, perfect, thanks.
Bridge communications.
Well, first I want to thank our county coordinator, Don Hudson, for tabulating all the data on the E-Bridge reports. So thank you for doing that. I don't know, Don, you're going to report out on some new data. I know you reported last month
For E-Bridge,
E-Bridge.
just the weekly EMS coordinators report has screenshots of all the different categories and utilizations, so.
Great.
You can see we're still not where we want to be, but it's better now than ever, and we'll continue to peck away at it.
Okay, and I did get a couple correspondence regarding SPO2 placement on the E-Bridge. I don't know if that's been an issue, but a couple different agencies mentioned it, not finding it readily a place to put the SPO2 as a sort of bit file sign. Have others had a similar issue with E-Bridge? Yeah. So apparently that was a oversight. I think we need to take it back to E-Bridge and make sure that they have it front and center.
On all forms on the vitals,
I think it's important.
Yeah.
Yeah. Unless there's any discussion, I can't imagine anybody would feel otherwise.
Okay.
That's all I have.
Easy peasy. All right, Nassau EMS redesign tag, I think that's on hold.
Yeah.
Yeah. All right. Chairman Mackey, for your last meeting as chairman.
Thank you, Dr. Pruitt. Yeah, just a few things. First off, once again, the REMSCO awards dinner and stuff was held on November 20th. Great attendance. Once again, we had about 105, last count that I had. We're still working on the final report and stuff that'll be presented at the REMSCO meeting. We had 10 awards going out. Again, congratulations to all of the regional award winners. Also to Northwell EMS. They took the New York State Agency of the Year Award. I believe this is the fourth award in the last 3 years on a state level that we've received and stuff. So once again, congratulations to them as well. As I said, we'll have a final report and stuff regarding the costs and stuff on that, but thank you for all those that attended. And once again, we'll have more on the next award ceremony. The awards generally will be going out starting January 1st and will be out there until April. So we'll get it out into the coordinated report and open up for the awards to be and nominations to be sent in. We had a preliminary meeting regarding the EMS memorial, which we had planned to look at in Eisenhower Park. And I've been in consultation with the Fire Commission as well to make it a first responder type memorial, as their memorial currently in Eisenhower Park is in need of significant repair or once again actually replacement with that. Stay tuned for that. Once again, we had a preliminary with the architect yesterday to go over some of the parameters and look at some of the potential necessities and stuff in order to create that and to get a design so that we can go out for a cost analysis to see what it would cost and how we can generate funds and grants and stuff to be able to do that. Program agency contract, once again, we're up for a 5-year award. The Fire Marshal's Office has taken on the program agency administrative. We've made the payments and stuff to them, once again, for the administrative assistance going forward with that. We're just waiting on the final documents to come through from the state to sign off on that, but that will be for with a 5-year contract and stuff, just a little bit behind, on that. Just a reminder, agency surveys and medical director forms due by January 31st, 2025. We've had full compliance the past 2 years. We anticipate no less this year. Once again, you know, don't wait until the last minute regarding that. Bylaw committee met earlier today along with the executive committee. The bylaws, once again, should be reviewed every 2 years. I think we might have missed a cycle. We started going through the bylaws. It's gonna take a little bit. We've solidified a couple of questions as there was some ambiguous language in there today, and we'll continue to meet and come up with a final draft and hopefully be able to finalize the bylaws, any amendments necessary in the beginning of 2025 at some point. As you know, at the last regional council meeting, there were 7 letters sent out to various constituencies within the council that were in non-compliance regarding membership, attendance, and everything with that. 6 out of the 7 responded back. There was a question mark and there was a motion made regarding the county executive seat. Since that, once again, was brought up, the county executive has sent us a letter and has nominated Dr. Irina Kelman from the Department of Health to fulfill that role here with the council. That will come up at the meeting in January. And once again, the council will be able to take care of whatever needs to be done regarding that. As I said, attendance for council members, we need full attendance at the meetings. It needs to be in person. There will be no virtual. And also, please get us the excusals early on, not 10 minutes before the meeting, so that we can make sure that we have a quorum with that. The next REMSCO meeting is scheduled for Wednesday, January 8th. As you know, it will be, January 1st is a Wednesday this year, which is New Year's Day. So January 8th is tentatively scheduled. That will be the next REMSCO meeting, 2 p.m. And it's planned to be held here at the Public Safety Center. And last but not least, on behalf of myself and everybody that sits around this table, I want to thank each and every one of you, all the committee members, all of the physicians, nurses, doctors, everybody on the REMAC. I've gone well above what I anticipated going into this 3 years ago. And it was a total team effort. We have accomplished most of the goals and stuff that I set forth for myself, and I will continue. We're transitioning currently. The new chairman, Dave Caldwell, will coming in. I've told him that I will stay active with the council and will assist him in any way possible regarding that. And we will once again have an orderly transition and continue to move forward. And I want to just wish everybody good luck and stuff as we move forward and stabilize the region with that. So that's all I have. And thank you very much for your kind words.
Anything for the chairman? Okay, thank you. So Dana Cordopasso has sent a letter requesting to be excused for today's meeting. She apologizes and says that going forward, she's gonna reach out to the REMSCO to see if she could have a alternate, because Northwell, her main employer, is going live with Epic. And she's got a very responsible position in implementing that software for the whole health system. So her time will be mixed between here and there, and so she doesn't want to abandon her post, so she's gonna see if you guys will allow an alternate. With that, she said she did review her notes, and she says that she met with North Shore, LIJ Valley Stream, and Nassau County Medical Center to discuss the diversion issue. She said all sites spoke about their proactive operational plans during the meeting, and like deploying resources early, utilizing trigger points when volume is high is something that they're doing and ongoing. So, it's being discussed, which is good. I think that we need to there's 13 hospitals in the region, and that's only 4. We need to get more involvement from our hospital colleagues. But I'm glad that some of the big ones are involved. We just gotta get South Nassau to the table and,
I'll work on that.
and the community hospitals, to sort of chime in. So is there anything you want me to bring back to Dana for the ED committee? Okay,
If you want to have her reach out to me, I'll take care of that.
Any questions on diversion would be now, or you have a separate discussion on diversion?
I was gonna discuss diversion under old business.
Okay.
You want to wait or you want, I mean,
Well,
bring it
just
up
a
now.
specific incident that came up that I think the REMAC should contact them to just clarify. The Long Beach campus of South Nassau is insisting that anytime South Nassau goes on diversion, that they are automatically on diversion as well. And we were unaware of that, and we're not sure that that's necessarily the case. So we just think we should clarify that with them.
I shall handle that.
Okay, thank you.
How's that?
Thank you. That's new to us. Okay. Second US coordinator. Sorry.
No, it's all good. So just to illustrate how good of a team, everyone else here pitches in to give my report. So thank you to everybody. I will just, thank you to Chuck, and your guidance and leadership and friendship, and experience has been unwavering. So thank you to that. And just happy holidays to everybody. I'll just short and sweet this time.
Okay, fantastic. So Chief Utero, we sort of went over, he's not here. Anybody from the fire marshal's office? Okay, great. So unfinished business, old business, E-Bridge updates, we have some work to do to get back to general devices at pulse oximetry. But so let's just so you'll reach out to general devices?
For the SPO2
Yeah,
change?
at pulse ox.
Yes, sir. We'll add it to all the forms.
Yeah. Great. And under old business, so regarding diversion, we got that one issue. Thank you. Is there any other things that are burning that, or has anybody else had any side discussions about diversion within their agency, within their department or their hospital that, we should bring up for this committee to discuss or consider? We really haven't made any headway either way, going to or from regional diversion. Again, partners to the east have no such diversion. Rhode Island just eliminated it altogether. But that was that document that I sent you. That was sort of a heads up. It became a thing at the beginning of November. I think it's something we need to keep on our radar, something that we need to keep thinking about. And if there's no further discussion here, we could discuss it at the ED committee, and I'll ask Dana to bring it up again and sort of rally everybody so we could get the people that it affects the most on the hospital side to sort of opine. Other old business includes the medical control tag. If you've submitted letters of interest to Chairman Mackey or to the region, please make sure that you get follow-up, that you've heard back. From what I've seen so far, there's only 3 people that have expressed interest in that committee. It's really a committee that needs to be a full thickness committee, from the providers who use it in the street, to the people who provide medical control, to NUMIC, to the NUMIC medical direction. From members from this body, everybody's got to sort of have a word or two in there. So this way, we make sure that we cover all the bases. 1, 2, nobody feels left out. I want everybody to have a say as to how the medical control policy is built. So please, Chairman Mackey has said he still wants to help steer that tag. And so please send your inquiries to him. If you don't know his email, send it to the REMSCO at nassau.org.
It's easier.
or send it to me and I'll pass it on to Chuck. Either way, just, this is, everything we do has to be done by committee. It can't be a committee of one or two, because then it's just not fair to those people. One, it's not fair to everybody else that uses that service, because then it'll be a service that's designed for one agency or one hospital as opposed to for the region. So we want to make a region-wide quality of medical control. So with regards to other old business and quality, there was, I had mentioned that we have a meeting with Director Greenberg tonight, and Division of Legal Affairs hopefully will be on the phone. I don't have anything else, I guess, about that. Is there any other old business that I forgot to bring up or didn't put on the agenda? Okay, so we have a bunch of new business items from the Airway Committee. So do you want to go ahead and bring up each action item?
I'll start with the easy one, that Seacliff be approved for IGL, Nassau County. Seacliff Fire Department.
Okay, so for the physician members, all approved? Okay, anybody opposed? Anybody abstain?
And then the second is that North will be approved as an RSI agency with the two action items that, one, we have to clarify the data collection and sharing, and two, the regional training. And they're coming back to us, so.
Are there any questions on the motion? Okay, all in favor? Anybody opposed? Anybody abstain? That's great. Job, Dave.
Thanks.
All right, and then you have others. You have 1, 2, 3 more.
That the regional airway course, you need all the ones that we did.
Clarify the requirement of how North
Okay.
will come back with the.
Yep, and then I guess the other ones we did is that the rescue medics are, the rescue medic training is a equivalent to the difficult airway course. It's the FDNY rescue medic training.
So to. Right, so
Is an equivalent difficult airway course.
Any questions? All in favor? Anybody opposed? Anybody abstain? Okay,
And then the last one would have been the new medics, so it's as RSI medics. So it's from New Hyde Park medics, Weber, Taylor, and Fader. From Glen Cove EMS, it's Valicenti and Valicenti, and from Legal Point Lookout, it's Darien. So those are the 6.
and that, they were vetted and approved by the Airway Committee. Any questions on the motion to approve those new medics as RSI medics? Okay, all in favor? Anybody opposed? Anybody abstain? Okay, that's great, unanimous pass. Is there any other new business?
Sorry, on my vice chair report, I just wanted to recognize our own coordinator, Don Hudson, for his recent nomination and winning the position of second vice chair for the state, New York State SEMSCO.
Oh, yeah, Don, congratulations.
Oh,
Congratulations, Don Hudson. With that comes another flak jacket and helmet. Right, so Don is the chairman of the Training and Education Committee at the state level, and he just got moved up to the second vice chair. That's great. Any other new business? Thank you, Jeff. Yeah.
One other thing, maybe, I don't know if Kevin's here. Chairman O'Hara and stuff, I spoke with him earlier, just for awareness purposes, beginning in 2025. He's currently finalizing the training program for the new MCI disaster plan and stuff. And it's gonna be reviewed by the committee in the coming weeks and stuff. And the goal is sometime in the first quarter of 2025, we'll start getting it out to the agencies with the training program. Train the trainer type training. will allow them to go back to their agencies to get it out to their providers. It's multifaceted because we have a lot of different types of agencies, police, fire, as well as EMS and communications and stuff to deal with. So we hope to once again have that ready to be rolled out in early 2025. And once again, be able to get out to do those trainings of the leaders as well as the trainers within those agencies.
That's great. There's a lot of work put into that, so I can't wait to see it come out. Any other new business?
I just have a question, I guess, for.
I'm sorry, any other new business?
No, just tranexamic acid. I know that it was talked about on the trauma side, but there's actually a lot of really good data now on GI bleeding and GYN bleeding, which is more the medical side, so
But
I don't know how.
the protocols say that it has. to
Yeah,
be
it's not a
through-
hemorrhage protocol, it's a trauma protocol right now, I think, yeah,
That's changing also.
yeah.
Right. So
I just wanna
it's
put-
changing for obstetrical bleeding.
Yeah, I just want to put on the radar that there are other uses for it that we might want to consider, even if it's not being considered at the trauma
So then,
side.
just, if you have other considerations that are aside from obstetrical.
Yeah.
That you think warrant me presenting it to the protocol committee, let me know.
Yeah, that was
I
what,
could bring it
yeah,
up.
okay,
But I think they've already finalized the changes for version 2025. That will be voted on, that were voted on in that this.
That just got
most recent
voted on.
CMAQ.
got it,
They get approved by the Commissioner of Health in January and go into effect in July.
okay,
So right now, we're working on 2026's protocol.
got it, understood.
So we have plenty of time.
Okay.
So please, get me the literature, get me everything down.
I like it, that's good,
And bring it up.
all right, cool.
So just to that, to clarify, so for the providers and the agency leaders and medical directors, the Bureau will put out a change log with the entire new set of protocols, so you can see what's changed and what's not. Again, the live implementation won't be till July 25.
July 1st at midnight.
And to specifically address that, the collaborative working group changed the title of the trauma protocol to a hemorrhagic shock protocol, which is agnostic of cause,
Got it,
to include those. So it is in trauma protocol now. It will be in hemorrhagic shock protocol. It still exists as a regional opt-in. Just because it's a protocol doesn't mean an agency here can do it, but that's the discussion on the
yeah,
physician,
if it changes, then
trauma.
we're gonna have. to discuss
medical.
it, okay, perfect,
I'll just leave you with this thought. It's uncomfortable being in a room when the surgeons and the medical doctors fight. And if you don't know what I'm talking about, see me on the side, because apparently it's been long-standing in medicine. So I see a bunch of doctors nodding their heads. Nice to know the doctors have their issues just like our paramedics do. So thank you for being human.
Okay, any other questions, concerns, or anything for the good of the order? Okay, the last motion of the night, motion to adjourn, Dr. Tink, Dr. Rowe, all in favor? Thank you very
Happy
much.
holidays,
Happy
everybody.
holidays, everybody.